As we age, the probability that we could fall, hurt ourselves, perhaps break a bone really goes up. And that's why I'm at Raleigh Radiology today to learn about one of those kinds of fractures and how doctors here treat it. I'm talking with Dr. Cynthia Payne about VCF. Can you explain what that is?
A VCF, Yolanda, is a vertebral compression fracture, and it's a fracture of the vertebra in our spine. Unlike bones in the wrist, where the bone is long and snaps in half, which we're all familiar with, the vertebral fractures don't break in half. They actually wedged type of compression fracture where height is lost, the bone is not broken in half, and additionally, by wedging down like that, it changes our posture because it throws us forward. So the dowager hump that we've always thought about and associated with aging is not normal aging.
You have a great illustration here of what happens as we age, what things look like when we're young and how they change as we age.
I liken young bone to a nice fresh sponge with lots of density of bone cells. And we can take compressive fractures, forces. If you fall, the bone can take that and it will spring back, and you might be sore, but there are no serious consequences. As we age, people who develop osteoporosis, our vertebrae come to literally look like this. There are holes in it. There are fewer bone cells, and they're literally brittle. These little tiny walls are brittle.
Okay, let's talk about treatment for VCF.
This has allowed us to, if I can make the analogy, put a cast on the inside of the bone. The bones are usually very soft from the osteoporosis, so we can do this under just twilight sleep.
And what is this called?
This is the kyphoplasty needle.
Kyphoplasty, okay.
And we go into the bone, and when we've gotten that cannula in there, we insert a balloon. We inflate it, and it makes a cavity in the bone. And then we inject bone cement. This is the same cement that orthopedic surgeons have used for decades to cement in artificial hips. It goes into that space, and in the process of inflating the balloon, we hopefully have taken that wedge deformity and realigned the bone.
If someone comes in and gets this procedure, will there be any downtime?
It's a very rapid recovery when you look at the other option of 6 weeks of bed rest. We're able to do this on an outpatient basis at Rex Hospital. It takes about an hour to do it. It's done under twilight sleep through an IV, and the recovery time is 2 hours of bed rest.
Wow.
And then they go home, and we usually quote the statistics that 90% of patients will experience moderate to significant pain relief, usually within the first 3 days.
This is incredible news. Dr. Payne, thank you so much.
You're so welcome. Thank you, Yolanda.
You can learn more by visiting the website. It's RaleighRAD.com.